classic medical oncologist at NYU, and so my patients are all who have lung cancer. I am particularly interested in lung cancer in non-smoker populations, and as you mentioned, it appears that particularly Asian women who've never smoked cigarettes, do have a high incidence of getting lung cancer for reasons that we don't fully understand. But we do see that the presence of this EGFR mutation in their lung cancer, does seem to be higher, if not double, compared to the Caucasian population. And so this is something that we definitely have to do testing for in Asian patients who are diagnosed with lung cancers to see if they have this mutation. This mutation is very unique because not only does it help us to figure out treatment options, but it does help us to understand a little bit more about their lung cancer. Once they're on the drug, and if over time it's not as effective, then we do need to look into other treatment options. And that's where we either talk about chemotherapy or we talk about clinical trials. So clinical trials are looking at other inhibitors against EGFR. And so this is something that we definitely always explore, particularly here at NYU, in terms of seeing what are the next types of personalized medicine that we could offer to patients. In general, the population that we see really ranges. We do have some very young patients, unfortunately, some of them in their 40s who are diagnosed with lung cancer and had never smoked cigarettes before. We don't know why that is, but we are seeing this. As a result of what we're seeing in terms of many of these patients who have never smoked before being diagnosed with stage 4 lung cancer, we definitely need to do more about trying to early detect lung cancer so that we can catch them earlier when they are at a curative stage. And so that's actually one of my big research interests, is actually trying to expand lung cancer screening guidelines to non-smoker populations. And so in particular, we're conducting a study here to offer lung cancer screening with a low-dose CT scan of the chest to Asian women who have never smoked cigarettes before, again, to try to early detect lung cancer, for which then we have many more treatment options to offer. So that study is ongoing. That came out before ours is the TALENT study, which was a large screening study done in Taiwan for non-smokers. And one of their biggest findings was that they actually were detecting more lung cancers in this non-smoker population when you actually look at the studies that led to the guidelines for doing screening in smokers. So it definitely was very interesting that actually more lung cancers were being detected in this non-smoker population. Last month in ASCO, our annual Association for the Society of Clinical Oncology, I actually presented preliminary data from our study, which was called the Female Asian Non-Smoker Screening Study. And so our lung cancer detection rate was on par with what they were seeing in Taiwan, also higher than what was seen in a smoking population as well. So again, it's very early data that we've presented so far, but we definitely are picking up lung cancers, again, in patients who have no symptoms at all and who are just getting this screening low-dose CT scan. So, the study is ongoing. We're looking to see how we can expand this further so that one day we could try to change the guidelines to include more people for the screening of lung cancer. As mentioned before, many of the clinical trials that we often offer to patients, and particularly in Asian patients, is especially in lung cancer, those who have never smoked, there are particular mutations such as EGFR, for which there are not a lot of treatment options for personalized medicine. So one patient that comes to mind is a young patient who had a EGFR mutation, which was a bit uncommon. She had progressed on multiple rounds of chemotherapy, but then after knowing that she had this particular EGFR mutation, there was a clinical trial that has a drug that could actually target this uncommon mutation. So this was something that was, very life-changing for her in terms of if she were not on this trial, she would have very limited options. The drug it does have its side effects, but she was extremely strong and very motivated to be on the study. As I mentioned, sometimes there are a lot of visits that are required as part of the study, but she was able to work out her schedule. Her family didn't exactly live nearby, but she was able to be on the study, and I definitely felt that she benefited from being on the study because of this clinical trial.